Hello everyone. In this video, we will be talking about our case of Amyand hernia,
which has been published in Pediatric Science Journal, Cairo University.
Amyand hernia is defined as the entrapment of the appendix within the sac of an inguinal hernia. It is also a rare condition constituting less than 1% of inguinal hernia, and it's 3 times more likely to be diagnosed in older children rather than adults, with male to female ratio by 9:1. It is clinically silent, yet it could be an emergency condition as once it's inflamed or perforated in the tight space of the inguinal hernia, it poses 14 to 30% mortality. And our case was a full-term 26-day-old male infant accidentally discovered a 2-day history of right inguinal swelling and a 1-day history of being tense and irreducible. An history of non-bilious vomiting and normal defecation. On physical examination, there were tenderness over the irreducible swelling, and the skin overlying was edematous and erythematous. The neonate was vitally stable with no fever or features of sepsis. During inguinal exploration for hernial repair, the sac contained viable cecum and perforated appendix, which was attached to the sac, but there were no bands. So, the patient underwent a herniotomy and an appendectomy with an open approach. And on day 4 post-operative, he was vitally stable on room air, taking full vital feeds with a lax abdomen, and the scrotum was elevated. He was discharged by day 5 with antibiotic prescription. Follow-up was uneventful with a right inguinal scrotal edema that resolved spontaneously.
From the case that we had, we can simplify it into 3 main points, which will be further explained in the upcoming slide. The first one is Amyand hernia has a heterogeneous clinical pictures by means that it doesn't have any specific clinical pictures, and then it doesn't need any specific surgical approach. And we may face some difficulties in diagnosing Amyand hernia. Amyand hernia cannot be identified specifically because it appears with a wide spectrum of clinical pictures, as it may be asymptomatic with general manifestations, or it may has other symptoms such as an inguinal scrotal edema, as the case that was reported in a different paper where it presented with inguinal scrotal edema without palpable inguinal scrotal mass and a 19-day-old neonate. It can be appears also with erythema and even can mimic some other disease like orchitis, testicular torsions, or enterocolitis, which make the preoperative diagnosis difficult and mostly diagnosed intraoperatively. However, most cases present as encirculated right inguinal or inguinal scrotal swellings, so awareness of the surgeons about these rare conditions, as well as the clinical finding of irreducible hernia without the cardinal symptoms of intestinal obstructions raises the possibility of Amyand hernia. It is important also to raise the awareness to get to know some other differential diagnoses like necrotizing enterocolitis, torsion of the testes, epidermoorchitis, and intestinal obstructions. Then how about the ideal treatment? Although it seems like a special types of hernia, it actually doesn't need any specific surgical approach. The management relies upon its clinical presentations, whether it's urgent or not. As in our case, it was an emergency and was managed by open surgery, and during explorations for hernia repair, the sac contained viable cecum and perforated appendix, which was attached to the sac, but there was no bands, so the neonate underwent herniotomy and appendectomy.
To summarize, we could say that Amyand hernia is a relatively rare case, but once inflamed, the rate of mortality is higher and surgery is life-saving. However, there is a need to search more for the proper guideline in diagnosing and managing this type of hernia, since it's still very limited and obscure among each literature, and the available ones still don't have the proper answer. Thank you for listening. We hope you enjoy it.
And if you are interested in the full text paper, you can simply scan the barcode, and also you can visit Intuitive Surgeon on YouTube to find more about our latest update. We guarantee it will be so interesting. Have a nice day.